Live. Hello. My name is Abby. I'm the nurse practitioner here at Integrative Medical of Rockford, here with your Integrative Chat. February is American Heart Health Month. And today I don't want to chat about all the lifestyle things we can do to protect our heart, because I think a lot of us already know that. I want to go a little bit deeper. When we talk about heart health, one of the main things we want to address is the risk that you might have for having a heart attack or a stroke. Now, wouldn't there be a good thing if we could test to see your risk factors? And we could. Here at Integrative Medical of Rockford, we have lab testing that we use in order to test your risk. And we look at things such as your cholesterol, but also inflammation markers, metabolics, genetics, and fatty acid balance. So we'll start with your cholesterol. Most basic cholesterol panels will tell you your total cholesterol, as well as your good, which is your HDL, your LDL, which is your bad, and triglycerides. And this is really good, but when we're really looking at your risk factors, we want to go a little bit deeper. One of the things this test will help us to know is what are the size of the particles. So if you have LDL, which is your bad cholesterol, if it's small and sticky, that increases your risk for a heart attack or stroke. Or your HDL, you can have lots of HDL, but if it's not the right size, it's not doing its job of getting rid of some of the bad stuff, the LDL. We also want to take a look at inflammation markers. Whenever you have inflammation, that will increase your risk of a heart disease or stroke. So when we talk inflammation, we talk about it mostly in the arteries. So there are some markers that we can look at. Some would be fibrinogen, and this lets us know if there's any early signs of inflammation in those arteries. And then something you might not have heard of called MPO, it also gives us an idea of are there early blockages happening or breaking of a plaque that might be going on. We also look at your metabolic markers because the metabolic makeup of your body affects your risk of having a heart disease or stroke. So diabetes is a major one. So we have several tests we use to check for diabetes. There's your hemoglobin A1C, there's your fasting glucose, but we also use something called insulin resistance. And this lets us know if your body is processing the sugar correctly. And we also test for adiponectin. So those are some of the tests. And again, based on the results, it lets us know your cardiac risk. Then we have genetics as a part of this test. And genetics lets you know how well your body genetically can handle certain medications or nutrition. I'll give you an example of a statin. There are some people, when they take a statin, they actually get a lot of muscle aches. Well, we can test genetically to see if your body can handle a statin. Maybe that's a good option. Maybe we need to try something else. Another example of a genetic test we use would be for clots. Are you someone who forms clots very easily? All of these things are important to know because we want to be able to have a plan of care that's specific for you based on these results. The last part of the panel would be our fatty acid balance. And this lets us know how much of your body's fatty acid balance is made up of saturated fats, trans fats, omega-3s, omega-6s, and lots of other fats that also affect your cardiac risk. So here at Integrative Medical of Rockford, we do have testing so that you can take better care of your heart. And again, the whole purpose of it is so that we have more information, more detail, so that we can tailor the plan of care specifically to you. I am Nurse Practitioner Abby, and that has been your integrative chat. If you want some more information about this cardiac metabolic testing that we do here, call the office at 779-423-2044. You can check us out on our website, imorockford@gmail.com. So I will see you at the next chat, or better yet, in the office. Have a great day and a great heart month.